a patient came to me the other day and he says, I went to some other PTs and they flat out told them, they said, you know what, we're not interested in what is causing your pain. We're here to just manage the pain. So here are the exercises. And I thought, this is the worst kind of medical practice. It is so below basic requirement. It's almost malpractice if it isn't malpractice. What is managing your pain? When you don't know which system is causing the pain, what are you managing? You can't manage someone's pain without knowing what the cause is. And it was so shocking, but this is where we are. It makes me think that as I get older, I should have a cyanide tablet under my molar so I can just bite it when I've had enough, because I don't want to be treated by such stupidity. I can't take it. Yeah.
Well, just, forget this. Just come to me. I'll give you the final neck adjustment. We'll take care of it. Just like that.
Yeah. Thank you. Because I will need help.
Cyanide can be rough. You might not swallow it all.
I won't swallow. Okay. Thank you. At least I now know someone will help me, because this is beyond what I think I can tolerate in my old age, is to talk to someone who thinks that they will manage my pain. And the usual thing is a series of exercises, of generic exercises that have no bearing on being specific and to take care of what I suspect I might have. So it is shocking. But I hope that clears up the algorithm for the extremities, and that is the same for the spherical joints and actually the head and neck as an extremity, which I consider it to be outside the torso. And so we must be able to do the muscle tests that belong to the main muscle groups. We must know what those muscles' functions are. And after that, when we have treated this local problem, then we go to chaining up the muscle groups. We must now see if the chains themselves are patent for functional movement. And with that, then you can start exercises or continue exercises, and then look to see if people are competent in the basic building blocks of movement, which is DNS.
Right.
So that is what you must see. Are they competent, and do they master these building blocks of movement and can put them together in synergies and then into ADLs?
Well, and you just, in the minute, what you just said, that's a whole bunch. That's a whole lot of stuff. You said once you reduce the symptoms in the extremity, that's one thing.
Mm-hmm.
Then you go to the proximal spherical joint, like the hip or the shoulder, to make sure it's functioning properly, which involves testing the major muscle groups around there, which is a whole thing. Making sure that they're patent and facilitated. Then it's, okay, well, now we're going to check the muscle chains around all of these joints. And there's a whole variety of muscle chains in particular planes in particular positions that, of course, we're not going to go into every detail, but that's a whole thing. And from there, it's once you identify, this person, the particular chain in this particular position seems to be inhibited or weak or whatever, however you want to describe it. Well, now we can utilize the most basic positions of movement and stability, which is described by DNS, to attempt to re-facilitate, restore, invigorate, however you want to describe those particular chains. And then from there, you could have an understanding of how the chain or how the fundamental movement of DNS has a role or a basis in the more functional movement or the ADL movement.
That's right.
More specific.
Yes.
But that's very complicated. None of that is easy. It's easy to just describe in a minute.
It is, well, yes, because you must keep it in mind. And one thing I want to also touch upon is that it is one thing for a muscle to pass the basic isometric test of normalcy. It is another thing for the muscle to pass a functional test of loading in the required position or the required task. The two do not necessarily go together, and we must not assume that passing one makes it function in the other. One is just a basic asking if the worker is present for work. He says yes does not mean he's done his day's duties. He just says, yes, I am here. Yes.
I mean, I agree with you 100%. But like what you're getting into now will not complicate. I mean, it will so complicate things if you were to want to test these muscles in particular positions.
But what we do, you see, but wait, so you must see, one, that a muscle is competent and answers yes to the call of contraction. Two, right. Does it participate in the chain as a component of a chain? Is it patent in the chain with its friends? And three, when you load it in a functional, whether it is a single leg squat, whether it is a lunge, whether it is an overhead dumbbell press, is that muscle meeting the requirements that says, yes, I'm still working in this position? Those are the minimum three things that the muscle must show you it can do, because those are the conditions under which we expect it to work. So I think that it is, because sometimes you can have a DNS position, but it does not tell, it looks off, but it doesn't tell you which muscles are causing it to be off.
Well, let's actually talk through that a second.
Okay.
So let's, placing it into context, you've gotten the person to the point where you're testing the major muscle group around the hip.
Yes.
You've centrated the hip, you're testing the major muscle group around the hip, and glute medius, an aspect of glute medius is weak. So you can facilitate it and it gets strong. Now that basic muscle test is by definition a basic competency test.
Yes.
At that point, I think in the flow, we would then check some muscle chains. And if they pass the muscle chain tests that involve, some of them involve the glute medius, then you can just assume that glute medius is working in the basic test and it's working inside of the muscle chain test.
That's
and
right.
Then you place them into a squat or a single leg squat or a lunge or whatever you want to do. And as long as it looks good, you say, okay, well, the glute medius must be working because it looks they're doing this fundamental movement well based on my inspection.
Yeah.
That's the thought process.
That is the thought process, because I am going to use a movement that demands the most of the glute medius. That is it. So I try to isolate the glute medius as the agonist of that functional movement. And I see, do you meet loading capacity? Because something might be good when I don't put much load on it. But when I start to put load on it, it fails. That is where resilience and strengthening comes in.
Right.
So that's when I go, oh, this muscle is competent, but it doesn't have the strength to do a 50-pound lift or
that's the legitimate reason to actually start to strength train.
That's right. I must know now.
Loading things.
If you enjoyed this conversation and want to hear more like it, then please like this video and subscribe to our channel. You can also stay up to date on our latest seminars on our social media pages on Instagram and Facebook @IMTR Seminars.